Hello, this is Simon Hyatt. I'm the contributing editor of Healthcare Asia magazine. Today I'm presenting the Healthcare Asia Awards, recognizing the remarkable achievements and initiatives of Asia Pacific's leading healthcare providers and companies. Today I'm joined by Dr. Eugenio Ramos, President and CEO of the Medical City. The hospital has won the Hospital of the Year Award for the Philippines in the Healthcare Asia Awards 2022. Eugenio, thank you so much for joining me today.
Thank you.
Congratulations on your award win.
Thank you, Simon. And in behalf of the Medical City Enterprise, I would like to say thank you to Healthcare Asia for recognizing us once again. I think this is the second time that we have been recognized. And I tell you that recognition like this actually inspires and energizes the team back home in Manila. In the Philippines, actually, because we are an enterprise at this time. Yeah.
Eugenio, how do you maintain quality service in your acute myocardial infarction program? How did the program fare during the onset of the pandemic?
Well, Simon, first and foremost, I'd like to say that the acute myocardial infarction certification program is the only one in the Philippines that has been recognized by the JCI. I think there's one here in Singapore. We're just one of the 10, I think, in the world that has been recognized, going through all the rigid processes to make sure that we are able to actually improve clinical outcomes. Acute myocardial infarction or acute heart attack is acute, no? And it does not choose whether you are in a pandemic or not. And in fact, because of the pandemic and because of the nature of the COVID-19, the disease is actually vascular. And you can see now that looking back, a lot of the cases because of COVID has been because of acute myocardial infarction and strokes as well. We never closed, and there was always a team that was ready 24 hours, 24/7 during the peak of the pandemic. And the rigid regimen that we have is really in terms of the countdown from the time that the patient is actually admitted and quickly diagnosed and brought to the cath lab and actually done reperfusion, and all the way to admission to the ICU temporarily, and then back to the private room, up to the rehabilitation. The certification and the discipline that we have acquired over the years, because we've had this since 2015, has really significantly improved clinical outcomes in the Philippines. And in fact, this is something that the Philippine Heart Association is quite proud of. So the acute myocardial infarction certification program of the Medical City has really put Medical City and the Philippines, I think, up there in terms of clinical survival.
Now that COVID restrictions are easing in the Philippines, how do you intend on incorporating relevant strategies into your new normal?
Yeah. Well, the new normal, for a while, we had difficulty in really defining what a new normal is. New normal initially was, after the COVID. And then later on, we realized that COVID was here to stay. The pandemic, the surges may actually go down, but COVID is here to stay. So the new normal is no longer a world where there is no COVID or there is no pandemic. The new normal now includes all these things that have caused us to really rethink the way we take care of our patients, the way we welcome them to the hospital, the fear that's there. And so the new normal that we're talking about is really putting in COVID as part and parcel of everyday life in the hospital. We needed to first address the issue of fear. Fear is still around, and sometimes the fear is so magnified and unreasonable. And a lot of those patients who otherwise should actually be in the hospital actually prevent themselves from being brought to the hospital because of that fear. So we had to do a lot to really lessen that fear because, initially, even the doctors themselves were guilty of actually perpetuating that kind of fear because they themselves were also fearful of the pandemic and the COVID-19. So we have succeeded in lessening that down. And during the time that we had to cope, we had to repurpose. We do a lot of repurposing. We had to refresh. We had to reboot. And then we realized that we needed to accelerate our digital transformation process. The digital transformation has been there even before the pandemic. And we thought that, it would take some time. But during the pandemic, lo and behold, everything just went like that, and everyone wanted digital already. So the resistance was not there anymore. But we were kind of stunned initially, and we thought that we just put this thing on one side first, our hospital information system, because we were already in the process of changing our hospital information system. But because of the pandemic, we kind of put it on hold. Then we realized after the first year that we needed to accelerate it, because now it was, now more than ever, it was really necessary that we actually kind of escalate everything as far as digital transformation is concerned. At the second peak of the COVID-19 in 2021, last year, we actually launched our new health information system. And that was kind of risky because, the transfer or the transition from the old one, which was not so effective, to the new one required a lot of preparation. And in addition to that, just a month after that, we were also preparing for the JCI reaccreditation. Now, that was our decision, that was my decision, that we could not kind of put everything on hold and really say that the new normal, in answer to your question, should be to really get back into the groove and really get ongoing and not let this COVID thing actually interfere with the progress of our hospital. So to make the long story short, in 2021, the third surge that we have in 2021, we had more morbidities and mortalities in the Philippines than in 2020, actually. We did not have the vaccination. There was a delay in the Department of Health's availability of the vaccines, and we started vaccinating only, I think, around February or March of 2021. So we still had a lot of mortalities there. But in spite of that, we thought that we needed to really get over the hurdle and just really push on with providing the kind of care that everyone deserves. No? And we finished our JCI. It was online for the first time. It was just as tough as the actual visit, because with the online, they were even more stringent in trying to make sure that the quality and all the other things that they were really looking at, we were able to satisfy them. So we were also able to actually recertify our acute myocardial infarction, also online. So 2021, at the peak of the second surge of COVID, when we were just about to transfer from our old hospital information system to the new information system, starting everyone into our electronic medical record, all these changes, in the presence of fear and hesitancy, we moved on and we got our accreditation again. This is our sixth, I think. And, we have every reason to really be happy and be proud.
I've heard a lot of this positive externality story from the pandemic that accelerated and expedited the move toward digitization. And it actually brings me to my third question, which is, can you tell us a little bit more about the new hospital information system and the electronic medical records? How has this improved hospital operations, and how do you ensure that patient data is protected from cyber threats?
Well, first and foremost, I'd like to say that cybersecurity is so important. And when we started moving from the old one, old hospital information system, to the new one, cybersecurity was top of it. Now, especially because at that time, the digital thing was already more or less mainstream. And so there were now talk about hackers and all these things. So we needed to really revisit our protocols and actually invest in the necessary infrastructure to make sure that cybersecurity is up there. The acceleration of digital transformation because of the pandemic, the distancing and people refusing to or hesitant to really go to the hospitals to see their doctors. Doctors themselves not wanting to go to the hospital now actually opened up our 2022 strategic plan, which is basically Medical City Anytime, Anywhere, which was very, very dependent on digital infrastructure. So with the digital infrastructure, and sometime in July, we actually launched our new health information system. Together with that, along the electronic medical record, and a lot of digital solutions like online consultation. Then we move now into our home care outside the hospital. So maybe later on, Hospital of the Year should go beyond just the hospital, which is basically the brick and mortar, because the hospital, the healthcare that we are looking at would no longer be just limited to the hospital, but outside the hospital, to the home care. We are also going towards corporate care and community care. And at any time, with the digital backbone that we are now finally able to put in place, it will take a while. We can really say medical city care or healthcare anytime, anywhere.
Eugenio, are there other aspects of the hospital that you would hope to improve upon in the future? And what else do you aspire to achieve in the short term and the medium term for the medical city?
Ironically, as we move on, we really need to revisit the main question, Simon. Why are we here? And why we are here is really to provide access to really excellent quality care to as many people as possible, really find a way to lessen the cost. And lessen the cost is not just about the prices that we charge, but also trying to improve all the processes that we have. The practices have to be changed. The practice models of doctors have to be changed. We are there on a paper, it's a personal practice model. Unlike here in Singapore, that they have actually the socialized medicine practice where, everything is controlled. Maybe that's too much, but, there is some discipline. We would like to go to that because eventually being recognized as a Hospital of the Year or a healthcare institution really should focus on how do we impact care and how much access do we provide quality care to as many Filipinos as possible. And that's where we're headed. Ironically, as we progress, we go back there, but this time with the aid of technology. And with the technology, we are able to shorten all the processes and really cut down a lot of all those delays that actually add to the cost of healthcare. And we will be able to actually say that we provide access to healthcare to as many Filipinos as possible without having to lose a limb and life, for that. So that's the future, and it's really going back to basics as well.
Dr. Eugenio Ramos, you speak with such empathy and enthusiasm, and congratulations to you and your team on the award win. It's fantastic to meet you, and we hope to see you again.
Thank you, Simon, and thank you to Healthcare Asia.
Thank you, sir.
Okay.